Hello and welcome. I'm Vincent McCory. This is Africa 54. Tonight, Africa's most populous country has confirmed its 11th case of Ebola virus. Nigeria's health minister says a doctor who treated the Liberian man who originally brought the disease to Lagos has fallen ill. Joining us now with the latest information on the West Africa Ebola epidemic is Africa 54 health correspondent Linord Moudou.
Nigerian Health Minister Onyebuchi Chukwu confirmed the 11th case of Ebola at a press conference in Abuja today. He says that out of 11 cases, 3 people are dead. An ECOWAS protocol officer, a Nigerian nurse, and the initial case, Patrick Sawyer, who collapsed at Lagos Airport on July 20th. Minister Chukwu also says those who have been confirmed with the Ebola virus will soon be treated with the Nalo Silver experimental drug. Meanwhile, Zambia authorities say they are restricting travelers from the Ebola-affected nations from entering their country until further notice. They are also banning Zambians from traveling to those nations. And in Liberia, officials are hopeful that the arrival of a new experimental Ebola drug will offer 2 Liberian doctors who contracted the disease while attending the patients a ray of optimism. The drug ZMapp arrived in 2 boxes on a commercial flight from the United States Wednesday. The packages were escorted by Liberia's Minister of Foreign Affairs. The medicine was taken to a Monrovia hospital so it could be administered to the doctors. The 2 physicians will be the first Africans to receive the drug. The UN Health Agency says only 10 to 12 doses of the drug have been made, raising ethical questions about who should get the priority access. And as the Ebola outbreak continues to spread in West Africa, countries in other parts of Africa are stepping up their efforts to prepare for the worst. Zimbabwe's health ministry has created a national rapid response team to take preventive measures against the deadly Ebola virus. The nation's Minister of Health and Child Care, Dr. David Parinyatwa, says the country is on high alert against the outbreak that is spreading through West Africa.
Let's be more proactive and not wait until there's a case. That's why we then initiated that there be a meeting of SADC health ministers. We are going to be very proactive in terms of our ports. The airports, the Harare International, the Victoria Falls, and the Joshua Nkomo airports.
Dr. David Parinyatwa, who is also the incoming vice chairperson of the Southern African Development Community Health Ministers, met with his SADC counterparts recently to advocate a proactive approach to fighting Ebola in the region. Dr. David Okello, World Health Organization country representative in Nigeria, also attended the meeting.
At this moment, we do not have a cure. There is no vaccine. We need to put in place arrangements so that if we are in the most unlikely situation, if we find a case, we are able to deal with it. So we need to put in place arrangements because we live in a global village.
Observers say Zimbabwe's health sector remains weak. Meanwhile, Ugandan officials have dispatched a team of 20 medical practitioners to Guinea, Liberia, and Sierra Leone to provide assistance.
What we are doing is to help them build up the health system, make sure there is community awareness, make sure that they have good coordination between the stakeholders, making sure there are resources, making sure there are committees, making sure that community health workers and the leadership, making sure that people do not touch bodies. So all this is what they are lacking.
In 2007, Uganda was hit by a massive Ebola outbreak that killed 37 people. Medical experts say the country is skilled at containing viruses, given that it has dealt with several previous widespread epidemics.
I think there is significant improvement at this stage because a lot is being done to educate the communities, to let them know what is really going on, because whenever there is an outbreak for the first time, usually there is always panic and frustration, and it can be, communities can associate the disease to various things, you know.
The WHO says more than 1,000 people have died during the current Ebola outbreak in West Africa, and there are fears it may spread further. Joining us now live via Skype from Johannesburg, South Africa, is James Kambaki, Head of Human Resources and Field Recruitment at Medecins Sans Frontières, MSF. Mr. Kambaki, welcome to Africa 54. Mr. Kambaki, can you hear me?
Thank you.
Great. MSF has worked in outbreak.
Yes, I can hear you. Can you hear me?
Okay, great. MSF has worked on Ebola outbreak in the past in the Central African region. What makes this outbreak in West Africa so difficult to contain?
I think mainly it's the knowledge before. The knowledge is a bit lower, and that is what the problem is. And then the cultural practice that is very strongly adhered to in those particular countries. It really makes it hard for MSF and other organizations to actually stop the transmission. Then they understand each other and they can easily move between countries. That also makes it a bit difficult. Initially, at the beginning of the outbreak, there was quite a bit of uncoordination, and that made it like this duplication of work. There's not enough organizations or even the Ministry of Health stepping up to actually do either isolation or patient tracing or surveillance. So there was a bit of uncoordination in that regard that also made it a bit difficult.
Okay, now we've seen that this outbreak has affected several health workers, whether they were nurses or doctors even. Now, for someone who is in charge of human resources with MSF, how has this affected recruitment? Was it difficult? Is it hard to find volunteers to go fight this outbreak?
Yes, it is hard to find volunteers now. Two of my doctors have recently declined to actually take up missions in those particular countries. At the same time, we are looking for very specific skills and qualifications to actually work in these particular programs. We are requiring infectious disease doctors or doctors who have worked before in either hemorrhagic fever or Marburg or Ebola. And we also require quite a higher level of discipline when it comes to working these particular programs. Simply because the disease, you cannot afford to make errors when actually dealing with the patients there. Okay. So we want discipline, we want motivation, we want high skilled people.
Now, quickly, experimental treatment is being introduced in this whole process. What else will it take? What do you think in terms of moving forward to really put a stop to it? Mr. Kambaki, did you hear me? Okay. So again, all right, I think we lost Mr. Kambaki, and that was James Kambaki. He's head of human resources and field recruitment at Medecins Sans Frontières. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thank you very much. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.